புதிய தலைமுறை நேயர்களுக்கு வணக்கம். கொராக்பூர் சம்பவம் கொஞ்சம் கஷ்டம் தான், நமக்கு எல்லாத்துக்கும் ஞாபகம் இருக்கிறது. ஒரு 2017 அங்கே இருக்கிற ஒரு ஹாஸ்பிட்டலில் நிறைய பேர் மரணித்தார்கள். ஆக்சிஜன் சப்ளை கம்மியாக இருக்குதுன்னு சொல்லியிருந்தாங்க. கஃபீல் கான் அப்படின்னு ஒரு டாக்டர் வந்து ஆக்சிஜன் சப்ளை இங்கே வந்து பே அவுட்னால ரிலீஸ் பண்ணவே இல்லை, எங்களுக்கு வரவே இல்லை அப்படின்னு சொன்ன கொஞ்ச நேரத்துலேயே யூபி கவர்மெண்ட்லேருந்து யாருமே சாகலை அப்படின்னு நியூஸ் வந்துச்சு. 2 நாளுக்கு அப்புறம் அந்த கஃபீல் கான் அப்படிங்கிற மருத்துவர் மேலே தான் எல்லாமே தப்பு அப்படின்னு சொல்லிட்டு அவர் அரெஸ்ட் பண்ணாங்க. நிறைய பிரச்சனைகள் அதற்கு பிறகு அவர் தொடர்ந்து அவர் எங்கெல்லாம் போகிறாங்களோ எல்லா இடத்துலையுமே செக் பண்ணி அரெஸ்ட் பண்ணிகிட்டே இருந்தாங்க. இங்கே இருக்கிற ஒரு அரசாங்கம் இல்லை ஒரு மாநில அரசு அதோட டாப் ஹெட்டை வந்து நம்ம ஈகோ கிளாஷ் ஆச்சு அப்படின்னா அடுத்து என்ன நடக்கும்? அதுவும் ஒரு சாமானியர் இல்லாமல் ஒரு முஸ்லீம் டாக்டர் இங்கே இருக்கிற ஒரு அரசியல்வாதியை ஒரு சீஃப் மினிஸ்டரோட ஈகோவை கிளாஷ் ஆனால் என்ன நடக்கும் அப்படிங்கிறதுக்கான எடுத்துக்காட்டு தான் நம்ம முன்னாடி நம்ம கூட இருக்கிற டாக்டர் கஃபீல் கான். வெல்கம் சார்.
வணக்கம்.
அந்த ஒட்டுமொத்த சம்பவத்தையும் என்ன நடந்தது அப்படிங்கிறது ஒரு புக்காகவே எழுதியிருக்காரு. த கொராக்பூர் ஹாஸ்பிட்டல் ட்ராஜடி அப்படின்ட்டு தமிழ்லையும் அந்த புத்தகம் வந்திருக்கு. கொராக்பூர் மருத்துவமனையின் துயரச் சம்பவம் அப்படிங்கிற புத்தகம். என்ன நடந்தது அந்த பீரியடில், அதற்கு பிறகு என்னெல்லாம் அவர் சந்திச்சார், இப்போ எப்படி இருக்கார், எல்லாத்தையும் இந்த வீடியோவில் பேச போகிறோம். டியூரிங் தோஸ் டேஸ் யூ ஆர் த சென்சேஷன் அண்ட் wherever we see in social media that we had so many support for Kafeel Khan. What happened after that? After you said that there is oxygen shortage and only because of oxygen shortage we had these so many deaths. Did you hurt the ego of the heads of UP? Was it the sole reason for all your issues?
I think it's not an ego. I think they just wanted to save their health minister. And those officials who were sitting in the capital of Uttar Pradesh, Lucknow, were responsible for the payment of 68 lakh due to the supplier. I know the supplier has written, I have written that this, I have got all the letters, and this, see, the first letter was written in April 2017 itself, that give my money and otherwise I will stop oxygen. So they didn't give the money, and the supplier has given the affidavit in the High Court that they wanted 10% commission. So that comes around 7-8 lakh rupees, and he didn't pay that money, and that's why the auction was stopped and so many deaths happened. So to save the health minister and so to save their own government, the government came up with initially they came up with one theory that nothing happened, no deaths happened because of shortage of oxygen. Then they said that every August there is every year deaths happen in BRD because of the encephalitis, and when they could not bury the incident, they needed a scapegoat, and they found in me, because the media made me hero, masiha and all that for 2 days, and to change the narrative he just picked me up. And after that, yes, you can say once I came out of the prison, when the High Court has said that there is no evidence of medical negligence and corruption, I started speaking up. But because I saw those kids dying in front of me, so I started speaking up, and I asked the question, the same question the public was asking. If the High Court is saying that Dr. Kafeel has not killed those kids, who was the responsible for that? And I think that hurt the government.
After Yogi's period, media outlets, not media, mostly write that UP has developed so much in terms of infrastructure, in terms of health and everything. What's the reality? What's the real situation in UP when it comes to primary health centers?
See, they are the best expert in data manipulation, I will just say. You won't get a data of Gorakhpur's encephalitis deaths after 2017 incident. Previously, if you go back and you see in 25 years, every year 1,000 kids used to die only in the Gorakhpur region because of this Japanese encephalitis and other viral encephalitis. And suddenly after 2017 it disappeared. So they are I would say the big expert in data manipulation. The primary health center in the Gorakhpur or in the whole UP, I say, it's shambles. They work as a white elephant, I would say. You go, there is no doctors. There is most of the time it's run by the pharmacist or the nursing staff, and it closes after 1 o'clock. There is no infrastructures, and there is shortage of medicine and all. See, I agree that after the incident, the Yogi government has given enough fund to the BRD Medical College, and now even Gorakhpur has got All India AIMS Institute of Medical Science. But in terms of the progress and what you call an infrastructure, see, unemployment is very high in Uttar Pradesh. Still the health infrastructure is very bad. You can go for the district hospital to the primary health level, community health level. There is a very actually is crumbling, I would say. And then if you go for the inflation, that is the whole India is bearing the brunt. The only thing what Yogi government is doing for the past 6 years is they playing the politics of religion and caste. They dividing the people on the basis of religion and caste is just giving a morphine in the name of religion. They are giving the morphine to the, and especially to the youngsters, you know. So I'll tell you one incident. When we did this Doctors and Road, and we finished the 100th day on Gorakhpur itself. That was 21st July 2021. So one village head has called us for the dinner, and we were talking about how the COVID mismanagement has, you know, resulted in so many deaths. We had a survey that around 10 deaths happen in, you know, each village, and we have around 90,000 villages in UP. So you can imagine 9 lakh deaths itself in UP itself. So he said that I agree there is a mismanagement of COVID. I agree that there is so much inflation, we can't buy vegetables. I agree that our kids are not getting good health facility or education. I agree there is unemployment, but for 70 years, Congress has captured Sri Ramchandji, and Modi ji has rescued Sri Ramchandji. So when the mental bankruptcy, I'll call, when the person can think that God can be captured, and when the person think that a human being can rescue God, then you can't help it. So the poison of religion, that's what you know, division of people, that's what he is doing for the past 6 years.
During Corona pandemic, you were in prison. Even I read articles that you had written personalized. You had written letter to Prime Minister Modi,
yes,
stating that the conditions of the prisoners here are pathetic and they needs to be treated. Did you receive any response from the central government or the state government?
I sent a letter before the lockdown actually. Lockdown happened, I think, on 24th of March, and I wrote the letter on 18th of March, and I emphasize on more testing. Because in the prison, the social distancing what we are talking about was not possible. It was a small hall, and there will be more than 100 people, and you know, there is you have to stay together only. So social distancing was not at all in the list. Anyway, I emphasizes now to increase the ICU beds and everything, and I sent to the Prime Minister, and I got a reply. Yes, I got a reply after, I think, 3-4 months, and it was just, you know, that we have received your letter, and your NSA was justified. So I wrote a letter about COVID-19, and they sent a reply out about my NSA, that is was justified by UP government. They said that. So I think they didn't read the letter.
Was the letter in English?
Yes, it was English only.
During NSA, I guess you were already arrested. Before NSA, you were arrested for corruption charges and other stuff from BRD, and after you had a speech regarding CAA. After that, you were arrested in NSA. How do you see this pattern that happened to you? Do you think that all this happened just because you stood for the people and you spoke against the irregularities of the government, or was this all done because you were Kafeel Khan, a Muslim?
See, I agree that before this 2017 incident, I was just a common doctor going to the hospital, coming back, spending time with my family. But during my 8 months of first prison time, I realized that if something like this happened, I am a doctor, from good family, did good work, but still I can be penalized. So what will happen to the common people? So I realized that, you know, as a common Indian citizen, everybody has a responsibility to speak against the injustice done to anyone, anywhere, not even in India, all over the world. I was in Assam flood in 2019. I was in Assam flood and we were doing camp. And that time I met so many Assamese and they were searching for the papers, you know, and that the same time NRC list was announced in Assam and out 1.8 million people, 18 lakh people was out from that. They suddenly lost the Indian citizenship, and out of 18 lakh, only 6 lakh were Muslim, 12.5 lakh was non-Muslims. So who were they? They were street vendors, they were laborers, they were homeless people, they don't have the papers. So I saw what NRC and CA could do to the in Assam, and when they passed in the Lok Sabha on 12th of December 2019, the law itself, I thought that what is going to all over India. So I felt that I have a responsibility that I should tell the people about what is CA and RC. See, in 6 years of his term as a chief minister, I was behind bar for 500 days. 3 times I was imprisoned. Anti-CA or NRC agitation. I gave a speech in Aligarh, and then Uttar Pradesh government charged me with a National Security Act, and they picked me from Mumbai airport, where next day on the 29th, next day was Gandhiji's death anniversary, and I was supposed to address public speech and with Gandhiji's great grandson Tushar Gandhi in Kolaba, Mumbai, but they picked up me from Mumbai airport, and from 29 January, and they reached Aligarh only on 2nd, and that was the most horrible, I would say, that traumatized phase of my life. They used to take me to the different isolated buildings, deserted buildings, and they used to make me naked. They used to beat me with a stick belt, and they used to scream, you know. I don't know whether they were from special task force of Uttar Pradesh government or some look like some rowdy people, because they were drunk, and I could see the hatred in their eyes. I could see the hatred in their eyes, and they didn't give me food or water for 4 or 5 days. I was hungry. I used to scream. They said that you went to Japan to destabilize the government. I said, see, my passport is with the judiciary. How can I go outside India? And why you are saying Japan? You can say Pakistan. They said that you have made a powder which can kill millions of people. I said that if you are talking about corona, I am a doctor. I am not a scientist who can make a powder. So all these type of allegation. I was hungry. I was thirsty, and they beaten me so badly that my whole back, my leg, thigh, the buttocks, the skin was peeled off. I couldn't sleep on my back for months. I used to sleep on my abdomen. When I reached Mathura prison on 2nd of February, I was so hungry and thirsty that I forgot my pain of what they have given. I just begged the jailer that time that please give me just food and water. And he said that unless you stop talking against the government, we won't give you. And they put me in an isolated cell. In prison they have isolated cell. It is a small cell where you have to, the toilet and everything is there in that. And they left me there. I used to scream. Khana de do, give me food, give me water, give me food. I used to scream. I used to get fainted, get up, scream again. I was so hungry that I ate the grass outside my prison cell. I used to chew my shirt. When I used to go for pass urine, there used to be drop of urine, and it's so severe pain that I thought like I had a ureteric stone. Even though High Court and Supreme Court has given the clean sheet, I have not got my job back, even though other people, the principal and the in charge of oxygen supply and everybody got the job back. Even though High Court has stayed my suspension, they terminated me from my job. So life is tough. Life is tough. The continued victimization of not only me, the whole family is continue. My brother was shot where the chief minister was there in 2018, just 500 meter from the. My elder brother was also sent to prison for bogus charges. Our business, we became untouchable in our own hometown where I was born. I remember my mother when I came out of the Mathura prison. She cried a lot. She hugged me and she put me like, mere bete college se lag ja, come to me, come to me. She thought like I would not come back, and she was crying and crying and crying a lot. So it's not only me; the whole family has suffered. But again, the same thing is that somebody has to speak. Somebody has to stood up. So you know, everybody can't be a mute spectator against this tyranny and injustice.
Courts have suggested, courts have ordered that your payments you need to be repaid.
Yeah.
Did the UP government repay?
Yes, when the Supreme Court has ordered, they started paying me half salary. Okay. The suspension allows you what you say. That was given until I was terminated. Now they are not paying anything. I have filed a case in 2021 itself, and almost 2 years over, but that case I have not got my job back.
You have been working in TN for the past 1 year. How do you see the difference? How do you rate the primary healthcare centers in Tamil Nadu versus the primary healthcare center in North India, like in particular Uttar Pradesh?
There is no comparison. You can't compare. It's like sky and earth. You know, that much difference is there. The primary health center, the system in the Tamil Nadu is so robust. I have gone to some village and I have seen that they treat patient, they have medicine, they have infrastructure, they refer to the district hospital. Yeah, but I have seen the district hospital and government hospital, they are overburdened here, and you know, but if you compare to the UP, it's lot better. We see the statistician, you know, infant mortality rate in Tamil Nadu is 15. That means out of 1,000 babies born in Tamil Nadu, 15 died. But if you see in UP, it's 46. Maternal mortality rate means out of 1 lakh female who delivered babies, 54 die in Tamil Nadu and 161 in UP. So actually in UP, the primary health center works like just an elephant, and that is not the case in Tamil Nadu. Tamil Nadu has so many medical colleges, 84 medical colleges, is highest in the all over India. And if you compare to the population, Tamil Nadu population is around 7-8 crore, you know, 70-80 million, but Uttar Pradesh is around 300, you know. So it is a vast difference, and Tamil Nadu has more than 40 government medical college, you know.
In Tamil Nadu, the primary healthcare centers are so good because doctors doctors come through government colleges, government schools, and we have a pattern here. Like a particular doctor who is completing his UG here needs to work in some
2 years, yeah.
Rural healthcare centers. Whereas in UP, the state is completely different. Do you think that this has some reason behind the proper maintenance of primary healthcare centers here?
See, first you talked about the NEET. I think NEET is a tool to abolish reservation. See, a student who score 100 marks, only 100 out of 720, that is not even 20%. If his father has 1 crore money, he can get seat anywhere and he become a doctor. If one student who is belong to a poor socio-economic status, he got 600 marks out of 720, that is more than 80%, he won't get a seat. So slowly they are going away with the reservation, and I feel that NEET is a tool to abolish this reservation system. Now come to your part that yes, in Tamil Nadu I have seen that once you finish your MBBS you have to do rural thing, and you have so many medical colleges, and in Trivallur where I am working in Indira Medical College, there are like, you know, out of 150 students, there are more than 70-80% are girls. So girls are also getting becoming doctors and, you know, female empowerment. But if you come to the UP, so much corruption in the health system and all make it you know, like a infiltrated system. So they are all I think they are also planning for a 2-year bond for the periphery, but you have to instill this thing on all ground level, that we have to start from the primary health center, community health center to district hospital, to how we can manage the doctors. The government do post doctors there in the rural area, but they don't stay because of the safety reason, because of the so many other things, you know.
We see many news with regards to the condition of minorities in Uttar Pradesh, be it the bulldozer treatment that is being done to people in Uttar Pradesh, and we see a few media outlets praising it like anything, media outlets praising encounters in Uttar Pradesh. For this particular condition where minorities are being traumatized in India, do you think that media is also responsible for it?
Yeah, surely they are complicit. Media is complicit in whatever is happening in India. See, all 4 pillars of democracy, when you talk about the administrative, the political, the judiciary, the media, all are infiltrated with this ideology which BJP and RSS trying to propagate. But I have seen there are good people in each pillars, you know, and the media only made me hero, media only made me winner, and media only took me out. So I got support for so especially the digital media, I feel they still have the true journalism spirit alive. Now come to the atrocities on minority. I feel in India the 3 class of people are, you know, oppressed mainly. First is females. Whether they belong to whichever caste, whichever religion, and whichever socio-economic strata, they are oppressed, you know, they are victimized in the office, in the school, in the college, you know. 96 rapes happening in India every day, that's a huge number. Then Dalits atrocities is still on the rise, you know. Recently in Maharashtra, 4 Dalit men were, you know, hanged upside down and burned. So Dalit atrocity is happening, and yes, minorities are targeted. See, the government, to hide their failure on unemployment, on inflation, and, you know, their China issue or any other issue, they come up with this story, the theory, and they target to particular community. Whatever is happening is because of particular community, and they want people to believe that, and that is rising, and this is very, very fatal for the, you know, our democracy.
You have been arrested, you have been put under NSA, your brother has been shot, where Yogi Adityanath was having an function, I guess around 300 to 400 meters. You were in prison during pandemic. All this for saying that the hospital or the institution that you worked did not receive enough oxygen for kids and patients. Did you at any point of time regret for what you did?
No, no, not at all. Even if I get chance again today, even I have to save only one life, I would do it again. I don't regret. I don't regret at all. I believe that if you have a heart and if that heart is beating, you won't let any child to be die in front of you.
Did you meet any politicians post release? Did anyone come in for support of you after post release? Did you try to meet anyone? I guess you met Akhilesh.
Yes, sir. Yeah, see, I met almost all politicians all over India, and yes, Akhilesh Yadav, the Samajwadi Party leader, has supported me a lot, and even Priyanka Gandhi ma'am, that from Congress, when I came out of Mathura jail, they released me in the night around 12 o'clock, and Gorakhpur, my hometown, was 800 kilometers from Mathura, and she said that if I go to Rajasthan, that is Bharatpur is a border of Mathura, we have a Congress government and we will provide you house and security. So we are still, my family, my wife and kids are still in Jaipur, Rajasthan, and Congress government has given house and security. So yes, political parties have supported me, and I think I met Chief Minister M.K. Stalin sir also, and I have given the book, and he also inquired about me and he supported me. So I think I have met most of the political leaders in this country, and they supported me. For if you're asking about me joining politics, I think I am a doctor. I feel good when I treat children. I feel good when I do camps. So don't know in the future, but yes, right now we are working for right to healthcare movement.
How do you see this Udaynidhi fiasco? He spoke something about Sanatan Dharma and the complete northern India. It has changed. How do you see this? Is this the way it usually happens in northern India? If someone speaks something against the issues in particular religion?
See, I have not seen that video, but I read what he has said. I feel what he is trying to say is that the evils of the any religion should be weed off. Not to that Hindu ideology or what, but in what media and what BJP and RSS is trying to propagate, that he tried to weed out the Hindu dharma itself. So that's the way they manipulate things. That's what they even few prominent newspaper, they have put the headline that India bloc, that is alliance. India bloc spokesperson has called for genocide, So that's the way they manipulate people. People don't understand the illiteracy is so much in north that and the religious poison they are instilling in the mind. They don't understand fake news and misinformation. Disinformation goes.
Have you ever been treated as a Muslim doctor in Tamil Nadu?
No, not at all. See, it's been 1 year and I manage OPD and have learned Tamil also a little bit to interact with the patient. Vanakkam, eppadi irka, vadambakam, enne pannade, jora irka, chali irka, irambal, talevali, tondevali, vayarvali. So in 1 year I have got so much respect, and a lot of love, I will say. The village people around Pandur, that is not in Tiruvallur, little far, Pandur area, they started, calling me their home, and sisters and people. I never, in whole 1 year, I was always treated as a Dr. Kafeel Khan, a Kurandai doctor, not a Muslim doctor.
Thanks much, sir. Thank you.
புதிய தலைமுறை சேனலை யூடியூப்ல சப்ஸ்கிரைப் பண்ணுங்க.
புதிய தலைமுறை சோஷியல் மீடியா ஹேண்டில்ஸ் ஃபாலோ பண்ணுங்க. புதிய தலைமுறை ஆப்பை டவுன்லோட் பண்ணுங்க.
டிஜிட்டல் தளங்களில் புதிய தலைமுறை எங்கேயும் எப்போதும்.